Hi everyone, and welcome back to another YouTube video. For those of you who are new here, my name is Mare and I'm a first-year pharmacy resident. And for those of you who are returning, it is so great to have you here again. And today I'm excited to share with you all my tips for the month of January, which is synonymous with interview prep. So for me, this was the big month. This is when you get your interview offers and you want to be sure that you're preparing for those questions that you may get asked. So before we jump into things, I want to say a big congrats to all of you who have survived the month of December and submitted your residency applications or are at the end of submitting them. That is a huge feat, and to be on the other side of it is a really great place to be, and I hope you're all very proud of yourselves and took some time to decompress and unwind during this new year time frame, and hopefully before you go back into rotations or whatever you have coming up next. So once you've taken that time for yourself, it is time to jump into all things interview prep and whatnot. And so I, of course, have my notes here that I always keep on my laptop. And so we'll just go ahead and get right into it. And so the first thing is finding out that you got an interview offer, which is such an exciting time. It feels so good to know that all of your hard work paid off. And for me, I always took that as a sign that who I was on paper matched with the program and they were interested in getting to know me further. And this interview opportunity was a chance to show them who I am as a person. And am I somebody that they want to work with on a daily basis? Does my personality match up? And for a lack of better words, are the vibes there? Because at the end of the day, although that's such an obscure word sometimes, vibes are very much just this innate feeling that you get. And I didn't really think that that would be the case. I thought all of the programs that I applied to, I was super interested in. And you'll find that it becomes very clear when you start to speak with other people, just where you feel a fit and where you don't. And it's totally okay if you don't, because I absolutely have my fair share of those stories, and I'll share one with you all because I think it's probably the most telling one of the moment where I really embrace the idea that there are places that you will be a match with and places you won't. And at the end of the day, all it takes is one. Once you get your interviews, something to consider is looking at the pharmacy residency Reddit. I know that can be a very scary place, and so I always take things from there with a grain of salt, but it's a great way to kind of figure out when a program started releasing interviews, have any of the programs you're interested in reached out to any candidates. So something to consider if you're trying to keep a pulse on residency interviews. And from there, communication by program really varies. So as I shared previously, I applied to 14 programs, and to just break it down for you all and offer some transparency, out of those 14 programs, I was rejected by one program via email. So they let me know that they were not going to be extending an interview offer. I had a second program that did not reach out at all. So I never heard any communication from them, good or bad. So that was totally okay. And then out of the remaining 12, I had two preliminary interview offers. So the first one I received was a Zoom call for about 30 minutes, and the second one was a phone call for about 30 minutes as well. And so my first preliminary interview was my first interview experience exposure in general. And so that was the Zoom call. And this is probably the moment where I realized that it really is about the vibe. So I'll share my story, which is I was answering the question about what hobbies I took up during quarantine, and I had started my podcast, which I was really proud about. And I was sharing, almost got the word podcast out when I was redirected to share something that was non-pharmacy related. And yes, my podcast is pharmacy related. No, I did not pivot quick enough. I definitely had other things I could talk about. I learned how to play the ukulele. I started painting by numbers, so many things, right? But I was like, you know what? Let me stick down this path. I'm really proud of my podcast. And although it's pharmacy related, I thought I could manipulate it in a way so that it was more about the creative aspect about it, where I was talking about my creativity and how I took the initiative to really put myself out there and hopefully help others in the process. And at the end of my answer, I received the response back that, it's an interesting take. Some people create a podcast about pharmacy. I, on the other hand, took up embroidery, but I guess to each their own. And in that moment, have never been so sure that I would not receive an interview offer in my entire life. So you just feel the tone, you feel the vibes. I'm gonna say it a million times in this video, and you realize that some places you are just not a match with, and that was a-okay with me. And at the end of the day, it was a really great learning experience, and I'm glad it was my first experience with interviewing because It allowed me to get my nerves out of the way and really just adjust to this virtual interviewing experience, which was totally new for me as well. And at the end of the day, I did not receive a full interview offer from them, and that's more than okay. But for my second preliminary interview, the phone call went great. I did receive a full interview offer, and at the end of the day, I had 11 full interview offers. So over the course of January and February, spacing that out became really tricky. And that's actually what I want to talk about next, is that for timing, just to give you an idea, I've shared this on my Instagram before, is that my first interview offer was sent on January 8th. My first preliminary interview was on January 13th, and my first full interview was on January 27th. And then those extended my full interviews all the way until the very last week of February. So definitely went on for a little bit, but you know what? That's all good at the end of the day. And so in regard to fitting all of that in, I had one at the end of January, that first one, and then I had about 2 or 3 every week. For those of you who are not on rotation, that is such an awesome perk. I had no idea until I went through the experience myself that some pharmacy schools allow you to take that month off, which I think is such a great thing because you do have a lot going on when you have a rotation as well as interviews. But for those of you who don't, and if you are a UCSF student, the way that I managed it was that I had some that took place at the end of my first rotation of the year. So I was able to take the 3 days off in order to complete those. And for any additional days I needed off at the beginning of February, I was able to negotiate with my preceptor to take the patients in the afternoon that I had worked up, as well as do an additional project. And then for the remaining interviews that I had, those all fell in with my next rotation. So I took the max 3 days off there, and the way that I was able to swing taking the other days off during the week was I ended up working every Saturday for that rotation. So it was definitely a lot of work, and it definitely took having to work with my preceptors on it, but I was fortunate enough to be able to partake in my interviews and be able to make it up in another way. And it was a cool experience as a student, you know, after a couple of weekends, being able to see what it's like to be in the hospital on the weekend, but it definitely can be tiring. So being sure that you're checking in with yourself, staying hydrated, getting sleep, all really important things. The other thing I want to talk about is when you do get your invite, this was what happened last year at least, is that they'll offer you a list of different dates that they'll ask you to rank and send back. Be sure you're reading the instructions clearly. Some programs ask me to list my top 2, others ask me to list all 5 in whatever order. Whatever they offer you, be sure that you're following directions. It's a great way to make a good first impression, or I guess at this point, like a second impression, but you get the point. And so for me, what I did was I laid out on a physical calendar all of the dates for all of the programs. So as I was getting invites, I would list all of the dates that the programs were offering interviews, and I would write down next to them what I ranked it. And then that way I would never schedule a number 1 or a number 2 ranked interview on the day of another number 1 or number 2 ranked. And this helped me to avoid any overlap over the course of my entire interview experience, which is pretty incredible in my opinion. I feel like that's a lot to balance. And so for me, I found that to be pretty good. I think at the end of the day, if you're able to keep your number 1 and your number 2 blocked off, there shouldn't be much overlap. In the events that there is, and you do get scheduled for 2 on the same day, be clear in the timing and be able to communicate quickly to the programs involved which one that you want to let them know that you have a conflict. And now into the most exciting part of today, and I know what you all have been waiting for, which is approaching interview prep. So for me, I approached it as 2 different types of questions. I have the conventional interview questions and the clinical ones. And so to start off with the conventional ones, this is how I figured that programs are trying to figure out who I am as a person, kind of what I was talking about a little bit earlier in regard to what's my personality, how do I approach things, what's my thought process, who am I as a person. So definitely don't be afraid to be yourself, be who you would be on an everyday basis, and let your personality really come through. And for me, the way that I approached this was the flashcard method. My mom did this for interviews when she was my age, and so I continue to do that as well. It's a method that's shared on pharmacy, Instagram, and whatnot, and basically all it is taking flashcards and writing questions on one side and jotting down notes of what you would say on the back side. I have a list of 100 questions that I used from UCSF linked below, so definitely recommend that. I think they do a great job of being all-encompassing for all the different types of questions that you may get. And I think this is what worked best for me. I would go through like 20 a day for like a week, and then I did all 100, and then I would do like one day, each day on the weekend, I would try to run through all 100, just whatever I felt like made me feel the most comfortable. I tried not to go through them too many times because I really didn't want my answers to be rehearsed. And at that point, I had really worked on the pace of my answers. And so knowing that I was talking a little bit slower, I knew that my thoughts could catch up to where I needed to be. And so I really wanted my answers to sound as conversational as possible. And so for me, the way that I think about it, I'm trying to reach the point in an interview where the conversation I'm having, or that interview moment that I'm having, becomes a conversation that I would have with a preceptor or a mentor, somebody that I feel like I have a close connection with, but I would still regard in a professional manner. And I think kind of keeping this in mind helped to make me more calm and kind of treat them the way that I would with those people who have really supported me throughout my pharmacy journey, and realizing that the pharmacists on the other side of the screen are probably that for another person. And so that helped to make it a lot less scary for me personally. From there, the one thing I do want to warn you about is the tell me about yourself question, because I did get this right out the gate in every single interview. Without fail, you will get this, you'll hear this time and time again. Have your elevator pitch down, your 1 minute to a minute and 15 second just synopsis of who you are in this moment. And I'll share the infographic I made that I feel like really helped on the screen, and feel free to screenshot it. This for me was really just how I created the flow for myself, and I feel like was really helpful in being able to just jump straight into answering this question and rounding it out in a way that I felt was beneficial. The next thing to consider, and I just want to touch upon some specific questions that you may or may not come across, or that I felt like I was really nervous about addressing when it came to these conventional questions. And the first one is an impactful intervention. I think this gets asked quite often, in my opinion. And for me, the scariest part about all of this was thinking of something that I felt like was meaningful enough. And at the end of the day, what I realized after talking to a friend about their impactful intervention was that impactful can mean a lot of different things. You're not necessarily going to discover a brand new drug or anything as a student, but what you can do is you can figure out what matters to you and figure out what makes the biggest impact on the patient. At least for myself, what I really wanted to convey is that I care about patient-centered care, that I care about taking initiative, and that I really want to be somebody who's known for utilizing their resources and going above and beyond and really closing the loop and looking at patient-centered care as an opportunity to do good outside of what I was trained to do, and really just be a human that I'm connecting with another human. And so I took an example of a patient in the ICU who had a host of different problems, but at the end of the day, what the biggest takeaway was that I referenced my resources, that I was able to contact a providing team at another facility this patient had been at to work with that provider on a plan for their psychiatric medication regimen, and at the end of the day, even help them schedule their next outpatient clinic visit. And so for me, this really highlighted all of the things that were important to me. This was really just going above and beyond, talking to the patient, doing my own research, reaching out to people on my own, and coming back to my preceptor with a full thought out plan and being able to present that to the medical team that I was rounding with. And for me, that meant a lot. And having that patient say thank you to me for helping make this process that much less cumbersome, and having them be able to have a plan leaving the hospital, that's what mattered to me. I care about inpatient pharmacy. I wanted to be an acute care resident, and that's what I am today. But what I care about more than that is patient-centered care. I want to make sure my patient is fully taken care of, and not just inside of the hospital, but outside of it. So hopefully that can help you think of examples in your life as well that you may have hopefully written down on your Excel sheet about what are some impactful things that you've done for people. And think about what are the characteristics and values that you want programs to know about you if you were to be a resident at their institution. The next question is that I got that I feel like can also be really difficult is naming a time when a recommendation wasn't taken. I was in the emergency department and there was a patient with some unknown GI symptoms going on, and it sounded like the team was going towards C. diff treatment, but they had ordered metronidazole. For those of you who know, way back when, prior to this year actually, vancomycin is first line, and so in the ED there aren't many notes. It's hard to get a gauge of what's really going on unless you go lay eyes on the patient, talk to the provider. So I went up to them. They said that they wanted to do, them being the provider, that they wanted to use metronidazole until they had more information. I let them know what the guidelines recommended for C. diff in the event that that's what it was. We agreed to compromise in this time since the patient was receiving their labs, and I took it upon myself to follow up on those labs a little while later to then touch base with the provider again and come up with our game plan. So at the end of the day, it really isn't about what actually happened, more so how did you go about approaching it. So for me, again, it was about taking the initiative to go talk to the provider, again, taking a hands-on approach, really getting out there, not just sitting behind the computer. And in the event that we disagreed on what to do next, to come up with a plan of action on not only the compromise in that moment, but follow up in the long term. So that's what mattered to me. That's been my approach. And I feel like it's something that has stuck with me and I've been able to improve upon as well throughout my residency. And so in general, probably what you can take away from all of that is basically the approach that I take to answering questions. And it's similar to like the SBAR situation. So that's SBAR is situation, background, assessment, and response or reflection. And there's many different forms of this. There's a STAR method, things like that. But the biggest way I can explain it is that you explain the situation, give a little bit of background with it, and you give your assessment of it, and then what was your response and your reflection of it. For me, the biggest thing that I refuse to leave out of a response is what I took away from that scenario and how I plan to apply that moving forward. For me, that's the biggest reason that we have these questions and why we answer them. Because what's happened has happened, but who we are and what we do next, if we are able to grow and adapt, I think is the most beneficial. And so at the end of the day, the way that I break up answering a question is 30% of the situation itself and 70% highlighting the characteristics about myself. So many people have so many different opinions and thoughts on this, and I think that's fantastic. Again, I'll never say the way that I do something is the right way, just the way that I've done it. And so for me personally, I'm very concise with the situation, the background, and I spend a lot more time talking about how I assessed that situation, what steps I took, and how I was able to respond, and what I did to reflect so that I can move forward in a way that's showing that I'm willing to grow and learn. Going on from there, I guess the way that I recommend going through, the way that I recommend going through answering these questions is do it yourself first. Write down all of the questions. It's going to take you a long time, by the way. My hands started to cramp at the end of like by 60 or something, which is pretty far into it, but I recommend doing it. And run through yourself. Give yourself just one quick, as you're seeing them, just whatever's popping up in your head, just say it out loud and run with it. Just see what happens. Because I think that's also great practice for if you're ever approached with a question you don't know the answer to, just see what pops up at the top of your head. From there, I would recommend talking to yourself in a mirror. See the way that you come across. What are some facial expressions you make? See if your hand movements seem like a lot. Are you distracted by yourself? And so on and so forth. And the other thing that really helped, again, back to my podcast, is that just recording myself and hearing myself back, I could hear that I was still talking at a fast pace. And I still, even to this day, probably in this own video, I still talk really fast at times. And so for me, being cognizant of it and hearing it back really made me aware that even when I feel like I'm slowing down, that might not be the case. So food for thought. The next thing I recommend is running through responses with your friends. This was probably the most invaluable thing I could have done for myself preparing for interviews. Being able to be on a Zoom call with my friends opened up so many doors and really addressed a lot of the concerns I had. For a lot of the questions, I didn't even know where to go, where to start, if I even had an example. And like I mentioned with an impactful intervention, it took hearing one of my friends for it to even click to me like what I felt was impactful. And for me, running through it with my friends on Zoom also allowed me to work through how I come across in an interview virtually. So this was honestly such a fun night. I think we were on the call for like 4 or 5 hours, and we just ran through the questions we didn't feel like we had good answers for, or that we wanted to hear each other's advice or input about. And I think probably the best part was when there's a question, I think either on the UCSF list or someone had brought to the table about how would your friends describe you? And going through that was probably one of the best things we could have done for our friendship. And at the same time, it turned out to be such an amazing moment of really reminding each one of us that we're capable, that someone sees us as capable in all of these other amazing things. And at the end of the day, I was also asked, how would your friends view you? And I explained that I actually prepared for interviews with my friends on Zoom, and we talked about this, and these are their answers. And they will give you the answer themselves. Do you know what I mean? Work smarter, not harder. And if there's a question that asks, what do your friends think of you? Ask your friends what they think of you, and it'll be a truthful answer. You don't have to search, you don't have to make it up, because you'll be going straight to the source. And that's probably one of my favorite memories of all time. But just in general, out of this process, I know that I have friends for life out of that group. There's no doubt about it for me. The next thing I would recommend is reading a book, watching a new TV show, having those things on hand because you may get asked that. For me personally, I haven't read for fun in so long. I definitely did a better job of it over the last couple of months, but when I was an Appy student doing this residency thing, I had not read a book. And so just pick up a book. It's good for you to read something that's not pharmacy related and to have something to talk about. TV shows, that's always a good topic of conversation. You might get asked that as well. And definitely have hobbies. Don't be afraid to share them. If you have a hobby and someone asks you what your hobbies are, say what they are. It's not a trick question. They really want to know that you have a life outside of pharmacy and that you have the ability to balance things and that you have this way of being able to keep your wellness in check. So if they ask you what your hobbies are, feel free to share your hobbies, whatever that may be. And then from there, the other types of questions you might get are personality type or like the fun questions, which you should absolutely run with. Of course, maintain your professionalism, but the question that I love and I love my answer to because I think it's really basic, but at the same time really speaks to kind of like what I am thinking about when it comes to drugs. And so the question is like, what is your favorite drug? And I'll give you like a chance to guess before I go into it. So pause or like guess out loud. I can't hear you, so whatever. But my favorite drug is ceftriaxone. And the way that I phrase it all the time, and I think anybody who ever knows me in real life knows this, I love ceftriaxone because when I see it on a chart, I don't know what to expect. I don't know, does my patient have a pneumonia? Does my patient have a UTI? Does my patient have a meningitis? What's going on here? Ceftriaxone is really mysterious. You don't know what you're gonna get until you dig a little deeper, right? And it's also so simple in another regard. It is either 1 gram or 2 gram. It's only dosed once a day. We love that. Unless, of course, I see it dosed twice a day, every 12 hours, then I know maybe I have some meningitis here. What else is on the list? Ceftriaxone is one of those very, very deceitfully normal drugs. I feel like it's so commonplace, but at the same time can open so many doors to so many different things. And I think my favorite characteristic of all is that it's not renally dose adjusted. So at the end of the day, I love ceftriaxone. It's mysterious yet simple, but at the same time really effective and can take you down so many different treatment plans and paths. So ceftriaxone, don't look it over because honestly, it's my favorite drug. And then next up, yes, here we are. We have reached everyone's favorite and probably most scared aspect, most fearful aspect of the interview process, and that's the clinical questions. And for me, the way that I approach clinical questions is that my goal is not to get the answer right, but it's to make sure that those asking me the questions know how I got to my answer. Every single thought I have, I say out loud. And so for me, at the end of the day, my biggest tip is to talk it out. As soon as the question is asked of you, start to explain in a clear, concise, organized manner what you're going through in your head and just say it. Just say it out loud. It doesn't matter if you think, oh, they probably know that I know. No, say it. I don't even care what it is. Just say it. As long as it's following how you would think about things, if it's following a treatment algorithm, everything that you would do, how you would address your resources, how you would consult primary literature, every single thing, share it. Because that shows them how you think, what actions you're willing to take, and how you get to the end. And at the end of the day, this is the way that I've seen it, is that if you know the answer, great. But having the right answer won't mean anything if you don't show them how you got there. And if you don't know the answer, great. That gives you an opportunity to really show what you know as far as how to reach the end, and then you consult your guidelines. You let them know, this is the guideline that I would consult to figure out my dosing, that I figure out which drug, whatever it may be. So at the end of the day, the way that I think of it is that whether you know the answer or not, talk through everything. Be sure to highlight what resources you would use and what guidelines you would consult. On Instagram, there's RX Key Slides. She has a great infographic put together of the recent different clinical guidelines that are out there for common disease states. The other place that you can look is at the end of each RX Prep chapter. It'll reference the guidelines where they pulled their information from. So that's what I did. I made sure that I knew all of those, the top different ones for the disease states that I was looking over, which I'll share my list with you in a second. But be sure to mention the guideline. If you know the answer and you know the answer is right, still mention the guideline. If you don't know the answer and you're unsure, mention where you would find the answer. Because at the end of the day, and this has become apparently true, and not that I doubted it for a second, but part of being a pharmacist is that you'll get asked questions where you don't even know where to begin or what the answer is. And that's okay. That's part of the job. That's the name of the game. And so how are you going to go about those scenarios, which is important for the interviewers to see. And so at the end of the day, if you know the answer, if you don't, same strategy. But feel free to give your answer if you do know it. But if you don't worry, it's not a big deal. There's plenty of times where I end my answer with, and I would consult this guideline for dosing recommendations. If I would say, I don't know it off the top of my head, but I would consult the guidelines for this. If you're unsure, if you were unsure, I would not guess. Guessing is not worth it to me, in my opinion. I think showing how you get to the end result is what I consider to be the most important part. And I feel like I was the most comfortable with really leaving it at that. From there, the list of disease states that I was sure to review, again, I literally cannot remember. I am one of those people where when I interview, I blank on the question, unless it went really poorly, which is the one question I share with you all, or it was a question I got often, in which case everyone's getting it, or my friends told me about and was like, I got this question a million times. But for me, the disease states that I reviewed that were helpful, because this is the list I pulled from my journal last year, were stroke, heart failure, anticoagulation, pneumonias, so community and hospital ventilator-associated pneumonia, acute coronary syndrome, so ACS, diabetes, and hypertension. And so for me, the programs that were more acute care focused, I definitely had a huge inpatient focus that I was making sure that I definitely knew. And for those programs that were more well-rounded, that had an AmCare component, I definitely focused a little bit more on that transitions of care and the outpatient side of things. So when it comes to all of these disease states, again, these are the ones that I reviewed. And by reviewed, I mean I went into RX prep and read each chapter about. I knew exactly which guidelines matched up with these disease states, and I tried my best to really just know the info, be able to walk through those treatment algorithms and go basically walk through a whole patient. So I would start with the patient presenting to the ED all the way to this patient needing follow-up in however many days or months. So if you can do that for a patient, if you can think about them as a big picture, again, patient-centered, the whole gamut from, again, ED all the way to needing follow-up when they're discharged, I think you'll be in a really good position. But again, don't be afraid. I think they ask very straightforward and very fair questions. I don't think there's one interview where I felt like I was just at a complete loss, but that was just one interview. Every other interview, I feel like falls very much in line with the scope of what would be expected of an APPE student at this point. So don't worry, they're not going to throw some weird question on how to cure COVID at you. So it should be okay. And if somebody does, don't quote me on that, because if somebody does, I wouldn't know. I literally don't know what's happening in behind the scenes. But for me personally, my experience, everything was very much fair game. I feel like it was definitely some things I should know. And if I didn't, then knowing where to look for them was absolutely the right way to approach that question. And the last part of the clinical questions, or I guess just conventional or clinical questions in general, is practice how to say that you would like some more time to think of response. There were many a time where I did not know what I was going to say for the question, and I needed a moment to think. And in the moment, it can seem like, oh my God, I'll just pause and think about it. But for me, what I like to do is to address the fact that I had been asked a question and ask for some time. So for me, I would say that's an excellent question. I might need a few moments to think of an answer, if you don't mind. And they would be like, oh no, take all the time you would need and whatnot. And I would sit there and I would contemplate and maybe see what your contemplating face looks like for your own sake. Because at one point I looked at mine and I was like, I just look lost. So just be there and then just consider looking away from this, just looking down or to the side, whatever it may be. And then to jump back in and answer the question in a timely manner. Do your best. Again, you may get asked a question you don't know the answer to, but breathe. It's okay. It's not the end of the world. It's just one question. It's not going to dictate your entire future. And I know this video is now really, really long, but I really wanted to touch upon these things so that I could share my insight with you all, because I know the interview part is definitely super scary. I was a stress ball, if you can imagine. And so the last thing I want to touch upon quickly is the presentation aspect. You may get asked to deliver a presentation during your interview. And so I'll touch upon this more in the next video, but I wanted to give you a heads up in the event that you start getting your interview invites and you see on your agenda that you'll be asked to present. So I've included all of my presentations linked below so you can see them. I had 4 total presentations. I had an all about me, I had an interest topic, I had a clinical pearl presentation, and then a disease state presentation. And so I've included those all below because I had zero resources, zero references when I was doing it, and I would have really loved to have seen something and just kind of known what to do. To give you some more information, Slides Go is where I get all of my slides from. Fantastic source. I think it just makes it that much more fun. You can really customize it and move things around. The next thing, pick something relevant and pick something you're passionate about. If it's present on anything, I went the route of presenting on planning international travel because I love international travel and planning international travel in particular. So go for something like that. It doesn't have to be clinical. I also thought it was a trick question and like, oh, I should present on a disease state. Everyone at my interview, in all cases when we were left to do something that was of interest, chose to go with something non-pharmacy related. So you won't be alone. The other thing to consider is something relevant. So for me, when it came to the disease state and the clinical pearl for sure, I was going for something that was new, something that was kind of up and coming, that I'd kind of heard some buzz about. And then for the disease state, I wanted to do something different and unique. So something that wasn't like heart failure, that wasn't commonplace, but something that really spoke to what my interest was, which is emergency medicine. So that's why my disease state topic is on rabies. And then for clinical relevancy, I did the use of tenecteplase in acute ischemic stroke, which is something new and something that's kind of coming up in hospitals. And again, has to do with emergency medicine. And I thought would be cool to shed some light on. Other key, stay organized. I like to use objectives at the beginning of all of my presentations just to make sure that I was following what I had set out to do and that my audience knew where I was going with my information. My other tip is to make it interactive. I know that there are also, again, a lot of hot takes on this one. And so for me personally, I highly recommend making it interactive. It can be boring to sit there and listen to a bunch of presentations, but if you can start off with a quick question or end with one and just have people drop it in the chat, I think that that's an easy way to get people involved and make them know that you know how to engage an audience virtually, because now a lot of this is commonplace. And so being able to do that is a skill in itself. So just a little wisdom passed down from a preceptor of mine. And I asked my preceptor, actually, I was like, I want to make my presentations interactive. Do you have any tips? And she's the one who mentioned maybe just have people respond in the chat. So at that time, it was really revolutionary. I know we probably all do it now, but I needed an idea. So turn to your mentors and preceptors. They're great resources. Again, another thing, or not again, this is the first time I'm saying this, meet the time limit. Make sure that you are not exceeding it by more than like 10 seconds. People will cut you off exactly at that time, so make sure you can get there. And answer the prompt. Be sure you're answering the prompt. If you feel like you're swaying from it a lot, have somebody that you trust look over it and give you some honest feedback. This leads me to asking your mentors and preceptors for advice. Ask if they'd be willing to look over your presentations if you feel like you're unsure, if you want to clear anything up. They're there for you, so don't be afraid, or ask for somebody who you know or work with, anything like that. And I think one of the hardest things for me was disease state-wise. I knew I wanted to do something that I was passionate about, and if you know me in real life, maybe I've said this here, I don't know, rabies, I'm fascinated by it. For the All About Me presentation, I really want to make it a review of systems. And so I was just inspired by the fact that we work up patients, and so I thought I'd present myself in the same way. For the interest topic, I knew that I love travel and I know that I love planning things, and so putting all that together really made sense. But at the end of the day, the clinical pearl was where I had the hardest time figuring out something. And I don't think I came up with it until the weekend before that interview. So it was only a couple days before I finished that presentation. But Twitter RX is my biggest recommendation. Looking up that hashtag in Twitter, I think that will give you a great idea of kind of what are some things coming down the pipeline, what are some questions people are throwing out there, what are some things you can take a closer look into. So that's where I got my inspo. If you're at a loss, if you don't know where to turn, anything like that, that's my biggest recommendation. And now that this, 34-minute video is coming to an end, I hope this was helpful. I know we took a lot of twists and turns here and there, but there's so much that goes into interview prep. But at the same time, be yourself, just show up and show them who you are and how amazing you are, because they already see on paper that you would be an incredible asset. So make them see that you're a person that's fun to be around, somebody that you can share hobbies with, somebody that will show up every day and really be a positive presence and help advance pharmacy and really shed light on what our profession can do. So I want to say thank you so much to all of you for taking the time to watch. I hope that this was, again, helpful. If you have any questions, please feel free to leave them down below. If you want to reach out to me on Instagram, I'm there at mayor.virk, or at my podcast Instagram at Life on the Pharm podcast. I am always available there if you ever have any additional questions. And as always, resources are linked down below in the description box. And until I see you all again, probably mid-January, just so we can get a head start on what to expect on interview day, I hope you and your loved ones are staying safe and healthy, and I'll see y'all soon. Bye.